Hi guys, today's topic about muscle of larynx. There are two types of muscle of the larynx are. One is extrinsic muscle. Second is intrinsic muscles. These muscles are inside the laryngeal framework, while extrinsic muscles are outside the laryngeal framework. Outside the laryngeal framework are the extrinsic muscle which depress or elevate the whole larynx is extrinsic muscle, while intrinsic muscle are inside the laryngeal framework which act as sphincter or tensor or adductor or abductor. So these muscles are the intrinsic muscles. In this group, extrinsic muscles are divided into two parts: infraoid muscles and supraoid muscles. What are the infraoid muscles? Are sternocleidomastoid, sternothyroid, thyroarytenoid. These are the infrared muscle with inferior constrictor. These are the four infrared muscles: sternocleidomastoid, sternothyroid, thyroid, or inferior constrictor. These are the four named infrared muscle of the extrinsic muscle of the larynx. What are the supraoid muscles? Supraoid muscles are mylohyoid, geniohyoid, stylohyoid, digastric, salpingopharyngeus, stylopharyngeus, and palatopharyngeus. These are the seven muscles. So, infrahyoid group having sternohyoid, sternothyroid, thyrohyoid, and inferior constrictor. These are the four infrahyoid muscles. Suprahyoid muscles are seven named muscle: mylohyoid, geniohyoid, stylohyoid, digastric, salpingopharyngeus, stylopharyngeus, and palatopharyngeus. So total named muscle are 11 extrinsic muscles. Now talk about intrinsic muscles. If you see intrinsic muscle, this is epiglottis. This is the thyroid cartilage. T for thyroid cartilage. Below is the cricoid cartilage. This is anti-arch and this is the posterior lamina of cricoid cartilage. There are two arytenoid cartilage. So I will simplify this. There are two muscles which are originating from the this thyroid cartilage. Are the this is the thyroarytenoid TE towards epiglottis, that is thyroepiglotticus. Second muscles is the going toward the arytenoid, that is thyroarytenoids. So two named muscle are thyroepiglotticus toward the epiglottis, thyroarytenoids, that is about toward the arytenoid. So two muscle origin from the thyroid cartilage. Now three muscles which are origin from cricoid cartilage toward the thyroid, that is cricothyroids, towards the arytenoid, lateral cricoarytenoid, and posteriorly posterior cricoarytenoids. So three muscle origin from the cricoid cartilage: cricothyroid, lateral cricoarytenoid, and posterior cricoarytenoid. Now three muscles origin from arytenoid. One is oblique arytenoid, second is transverse transverse arytenoid. So two muscle between the arytenoid. One is paired muscle, that is oblique arytenoid. One is unpaired muscle, that is transverse arytenoid. One part of this oblique arytenoid, extension of this, is going toward the epiglottis. This is called aryepiglotticus. So these are total 8 named muscle. 8 named muscle, in which 7 are paired. Only one muscle is unpaired, that is transverse arytenoid. So name 8 named muscle, intrinsic muscles are thyroepiglotticus, thyroarytenoid from the thyroid, from the cricothyroid, lateral cricoarytenoid, posterior cricoarytenoid, 3 from cricoid and 3 from arytenoid, oblique arytenoid, transverse arytenoid, and one going toward the this epiglottis, that is aryepiglotticus. These are the 8 muscles. Now, what is the function of these muscles? It is considered as this thyroid part is this thyroepiglotticus is considered part from this thyroepiglotticus. So this thyroepiglotticus is extension of this, like these fiber going upwards from these fiber. It is considered extension of this thyroarytenoid. This aryepiglotticus considered extension of this oblique arytenoid. Now, what are the axons? Axons are, if you see, one axon is sphincter section. Sphincter action. Sphincter action means what muscles are closing or opening the laryngeal inlet. So, opening muscle of laryngeal inlet opening muscles are, if you see this diagram, so what will be the opening muscles? This is anteriorly and this epiglottis is like this. So opening muscle is the this. This is the thyroepiglotticus. So opening of laryngeal inlet is the thyroepiglotticus. This is pulling toward the arytenoid, aryepiglotticus. So closing of laryngeal inlet, closing muscle of laryngeal inlet is the this aryepiglotticus, with assisted by, this is extension of oblique arytenoid plus oblique arytenoid. So sphincter of the larynx are opening are thyroepiglotticus, closing are aryepiglotticus with oblique arytenoid. These are the three sphincters muscle of the larynx. Now, second action is abduction, abduction and adduction, which closes the glottis. Abduction and adduction, which are the open or closing muscles of the glottis. This rima glotticus. So only abductor muscle of this laryngeal intrinsic muscle of laryngeal is posterior. This is the posterior cricoarytenoid. So abductor is posterior cricoarytenoid. Okay. Adduction muscles are which taking the vocal cord towards the midline, that is lateral cricoarytenoid assisted by with these two oblique arytenoid and transverse arytenoid. So main adductor is the lateral cricoarytenoid. Main abductor is the posterior cricoarytenoid. Okay, these are the adductor and abductor muscles of the larynx. Now third is C. Third is tensioning and relaxing muscle. Tensioning and relaxing muscle of the larynx. So tensioning muscle is this cricothyroid. Cricothyroid. Main tensioning muscle of the larynx is cricothyroid because this cricothyroid contracts. This contraction lead to extension of this thyroid lamina anteriorly. So there is pulling of the vocal folds leading to tensioning, that is called cricothyroid. Relaxing muscles are these contract, so vocal fold will be relaxed. So thyroarytenoid and vocalis. Vocalis is the medial most part of the thyroarytenoid muscle. So these are the relaxing. So main relaxer is the thyroarytenoid. Main tensor of vocal cord is the cricothyroid. So this is very simple. You can identify this. This vocalis is medial most part of the thyroarytenoid, and this thyroepiglotticus is considered as extension of this thyroarytenoid. So total muscles are 8 named muscle of the intrinsic part of the larynx. All muscle are supplied by the recurrent laryngeal nerve, except this cricothyroid, which is supplied by the external branch of superior laryngeal nerve. So this is all about muscles of the larynx. Thank you.